So Braylon gets trach care every day. It's called daily tracheostomy care. So right now I'm just getting Braylon supplies ready. These are his gauze. I cut the gauze and I use the gauzes to clean around Mr. Braylon's neck. So I'm getting all of his supply ready and set up. I always use a towel or something so that it won't leak or get all over his bed. That's Mr. Braylon helping me. He always likes to be my little assistant and help me get his supplies together. So I'm laying his gauze out. I like to use gauzes for two for soap and water, two which are wet, and two which are going to be dry. And sometimes, or most of the time, I have a few backup gauzes just in case it's too soapy or it's too wet and I need to clean it more with a wet gauze and dry it more with a dry gauze. So at this point, I'm just sitting here getting Mr. Braylon ready for his trach care. So after I finish getting Braylon's trach tie and powdering his trach ties, I like to make sure that I have everything, his gauze, the trach tie. I like to clean him up, suction him, make sure there's not a lot of mucus in his airway when it's time to do his trach care. And like I say, Braylon likes to help me, so he's always touching this stuff, and I always have to tell him, stop touching. So I'm putting the soap on the gauze, and then I'm grabbing the water and putting the water on the gauzes that need water. And I did an extra gauze with water, and then I also have an extra gauze that's dried, so that I can, make sure I clean it like how it's supposed to be cleaned. So Braylon is now in the position for me to suction him and do his trach care. So I got Mr. Braylon laying down, okay? And sometimes he gets upset. He get nervous about getting his trach care done. He may not want to get it done, but I always explain to him, son, this is for your hygiene. This is for your health. This is what is best for you. So I'm getting ready to take the trach ties off. That's what I like to do first. You see I have my gloves on. I'm taking off the trach ties. I take the ties off, and then I like to make sure that I talk to Mr. Braylon during this process, letting him know what I'm doing while I'm doing it so that he will understand, and also so he will know how far along I am in the process. Every time I do his trach change or his trach care, I tell him the instructions and I tell him what I'm doing, and I always tell him the same things, and it kind of lets him know how far I am when doing his trach care. I always encourage him and tell him that he's doing so good, that he's a big boy, and I always thank him for letting me clean around his neck and doing his trach care. So as you see, this is the soapy gauze, okay? I'm going to clean both sides of his neck with the soapy gauze, and some people may do it different. Sometimes I do one side at a time. It just depends, especially on Mr. Braylon and how he's doing and how he's reacting to his trach care. So I'm just cleaning it really good, making sure that I clean the sides and the back around his neck. He's kind of unhappy because he does not like being in a situation where someone has him and is doing his trach care. Basically, he's not in control of what's going on. So he's not making the happiest face. He's not being hurt. He's not being harmed. We're just doing daily trach care, and he does not like it. So I'm making sure I clean around the neck. Clean, 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 clean. Wipe, 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 wipe. I'm making sure under his trach is clean, around his neck, around his stoma. You want to make sure it's all clean. Hygiene is really important. I like to give him little mommy kisses, hoping that it makes him feel better. And it gives me a chance to really dry around the back of his neck. Multitasking. So I always ask him, Braylon, please move your head to the side so your mama can clean. And now I'm just cleaning, cleaning, cleaning. Thank you guys for watching our video. If you are new, please feel free to subscribe if you have not already subscribed. It's 100% free to be a subscriber, to sit here and to see and learn more about Braylon and our everyday life and how I take care of him on a daily basis and watch him grow into the handsome, smart young man he is. So now it's time for the trach ties. Woohoo! So I put powder on his trach ties. That is to protect him from any breakdown that could occur from him having a trach tie around his neck. It keeps him from, bruising or having any type of breakdown in his neck. His neck looks pretty good, I might say. So I'm putting his trach ties on. And I always like to put his trach pad on Today he's going to get a cream trach pad. This goes under his trach ties, around his stoma and his trach, to protect around that area, to get drainage if there's any drainage, and to protect around that area. So, and it's pretty stylish. It's pretty cute. It goes with his outfits, his pajamas, whatever he have going on that day. So right now I'm doing what I like to call the two finger rule. And that's when I check Mr. Brilliant's trach ties just to make sure they're not too tight or too loose. Okay. So that's very loose. So I'm going to adjust it. And trust me, you guys, I'm not being rough with Brilliant. Brilliant is very strong and he tries to throw his neck and squeeze it so that I can't adjust his trach ties. But I always explain to him, safety first. Your mama have to adjust these trach ties. Be a big boy. Thank you everybody for watching. I sure hope this video helped you, and I sure hope I did a great job explaining his trach care. Have a beautiful day.